In that description, the surgeon begins by using a leaf to create the nose's shape. The skin on the forehead or cheek is cut to this shape, but left uncut at the point nearest the nose. Then the skin, blood still flowing into it, is twisted around, folded down to where the nose should be, and stitched into place. In a few weeks, when the graft has bonded and blood is flowing from all points, the place where it was still attached is cut. The secret is in keeping the blood flowing, and the brilliance in Sushruta's method comes from his understanding of the function of the blood in the body and its largest organ, the skin. Modern Western plastic surgery is based on exactly the same understanding, but the Ayurvedics understood it at least 2 millennia before modern doctors did. And what Natasha wants to do is to search ancient medicine for understandings that modern doctors may still not have. Jaya is ready for her operation. Without it, her life would be miserable, her chances of marriage, among many other things, negligible. The big advance made by modern medicine is this: anesthetics. Jaya will sleep through the whole operation and never feel any pain. Sushruta had ways of lessening pain too, but could he have induced complete unconsciousness? Maybe, maybe not. But now anesthetics not only eliminate pain, they allow the surgeon to take his time without worrying about the patient's suffering. It's a complex operation, and students are keen to watch, as is Natasha. Nowadays, it's usually cartilage taken from the ear that gives the new nose its shape. Ear cartilage wasn't used in Sushruta's time, but the overall principles are still the same.
Astoundingly, without the help of anesthetics, it's very close to the original operation that happened 3,000 years ago. They used the bit of the scar tissue to line the inside of the nose, some cartilage from the ear, and then they used the Sushruta flap, or the cheek flap, or a modified version of the Sushruta flap to fill in the defect over the top of the nose. So this way, the scar will get lost inside the crease, this crease here. So it's going to look very good, it's going to heal well, she's a child, the skin heals very well, and look almost as new.
A tube is inserted to help with breathing and to hold the nose's shape. In a few days, it'll come out. Dr. Avinda is confident that the operation has worked.
This young girl is going to be totally rehabilitated in this society with her reconstructed nose, with which she will be highly satisfied.
Sushruta's patients were probably satisfied too, even if they weren't sound asleep during the operation. But what drugs did Sushruta have? They're all still in the hospital garden.
That's a plant, you see, we call it gugul.
Gugul?
Yeah.
It's got a nice smell.
Very popular drug in Ayurveda to control pain, inflammation, and sepsis.
Fantastic, so it does a multi-purpose, it's a panacea.
Yeah, it is really a wonderful drug. At least it has a less side effect than aspirin in terms of your gastric irritation. And it is very good analgesic and anti-inflammatory.
For stitching, the early Ayurvedics had natural fibers with built-in antiseptics.
See, we are talking about suturing material, which are a plant origin.
Yeah.
You can see this is a fiber, it's a plant fiber.
It's like a vine or something.
You can see that this thread-like structure, which is from plant origin, this can be used for suturing of tissue, skin. I mean, it has described in Ayurveda, in Sushruta, for suturing.
Sushruta describes.
Yeah, this is as a suture.
It's very smooth. It would run through.
It's very smooth.
Very easily.
Yeah. The extract is used to improve the immunity, and this is used in drug-resistant tuberculosis and in HIV patients.
Oh, so fantastic. So this is a dual-purpose suture.
Yeah.
It can be used either as a suture and to increase immunity.
Yeah.
Fantastic.
As well as using plants for pain relief and stitching wounds, Sushruta details natural antiseptics and herbal drugs to aid recovery. Professor Sahu's team is still exploring the uses of the ancient remedies.
It would be really interesting if we could take that research that they're doing over in India and bring it back into Western surgical practices and see how it works in the laboratory setting.
Jaya will recuperate in hospital for a week, and it'll be about a year before the scarring starts to fade. But in the end, just like the princess, she'll have a normal nose and a normal life, thanks to a physician from 25 centuries ago. Natasha, meanwhile, goes on to look back 35 centuries. New discoveries bring her to Egypt, to a surgeon's tomb, to the woman who is still the standard for measuring beauty. But had Queen Nefertiti had a facelift? To be young and modern is to look great. Tight skin, firm muscles, pleasant face. But eventually, no matter how well we look after ourselves, our faces and bodies change. Most people accept the inevitable, but sometimes to be old and modern, not to mention rich, is to turn to plastic surgery. And this, after all, is Beverly Hills.
In the Beverly Hills area, there are probably over 100 plastic surgeons. And you figure each of those surgeons probably do around 10 operations a week. So you're looking at over 50,000 operations per year just in the Beverly Hills area. Okay, so if you look at your face here, MJ, the areas that we're going to be able to help are right here, where you have your little marionette, laugh line here, as well as...
Mary Jo has come in for plastic surgery on her face. At 45, she's still young for such treatment, but she wants to get a head start on old age.
Okay, and that's it.
Yikes. Today, I think we're just going to stay with the facelift, kind of a simple, no implants, no chin implants, no cheek implants. We're going to lift the jowls up, lift the neck back, I hope, take out some of the extra skin down here.
But what is a beautiful face? What defines beauty? In fact, there is a perfect face, a model, a gauge. And it belonged to a queen who lived 3,500 years ago. The Egyptian queen Nefertiti was regarded in her time as the most beautiful woman in the world. To today's plastic surgeons, she's the most beautiful who ever lived.
What's fascinating about the depictions of Queen Nefertiti and her face is that that's always been used in aesthetic surgery as the perfect face. Since classical times has been the idea or the notion of the golden ratio or the golden proportion, and different parts of her face fit within that golden proportion, and therefore her face was allegedly the most aesthetically pleasing face.